This is Dr. Raghu Sundaram, a member of ACCP, talking and illustrating about some of the material slides we are showing. Uh, we have a total healthcare clinic. We take care of instruct women, children, and men and women of different ages, so that it is a comprehensive care of their lung and their issues that were related. And we also focus on the family, how the relevant it is, what happens from childhood, and the development of the lungs.
Where ಯಾವುದೇ come from American to India and Pakistan.
We see, clinic. This clinic is free. We see children, women, and adults different ages, irrespective of caste, religion. This is a woman with sleep disorder. As you can see, she's sleeping while the busy clinic and noise is going around. Um, these are the senior citizens. Now we educate them about lung conditions, COPD, emphysema, asthma, smoking programs, and how to quit smoking, how to breathe right, and what are the problems related to secondhand smoking, and also illustrate the fact to the and this rehab for people with emphysema, asthma. We do the rehab program to help people to quit smoking and to better their lives. And we also talk about second smoking, the deceptive advertisements we see of different nature, just to focus on them and impress on them, not to be deceived or duped by these advertisements, which are very, very of high intensity quality. That this is ad to put down the cigarette smoke. And we deal with we go to schools and educate the children about not to pick up the cigarette habit, and educate them. These are the kids receiving us, and we illustrate and direct interact with the audiovisual material, illustrate on chemical things, and getting promise from them not to smoke. This is a hot model. We talk to the college, school, high school kids, children, adults, girls about this, me demonstrating the lung model and illustrating them on the proper nutrition to have healthy lungs, and also focusing on them not to smoke, keep healthy lifestyles, exercise. And these are again the high school kids, where I am showing them about the uh, ill effects of smoking, not to pick up the cigarette smoking, and cigarettes, telling them cigarettes contain cyanide, a deadly poison that is used to kill rats, and show them how it destroys their lungs, and also tell them nicotine is very addictive, and not to believe in cigarette ads, and to tell them about the correct way of breathing, various breathing exercises, illustrating the heart lung module, telling them how the cigarettes can damage, and more than 80% of the adult smokers started before they were 18 years old, so that they don't want to be go through the same history as they have done with their elders. These are the various clinic people who assist us. We call them Angan, ANG, and WADA workers. They go to house to spread our message about the lungs, healthy lungs, how to maintain good health, how to avoid the dangers of second-hand smoking, and also how to come to the clinic, when to pick up the disease and come to the clinic in timely fashion, how to monitor their disease. Um, and As you can see, we have a variety of um, and this is our doctor who is helping local doctor. We include the local doctors to help in the community. These are all of our volunteers, senior citizens, and we tell them about the problems related to breathing, how to control the breathing. This is one of our patients whom I am demonstrating about, impressing on the
One breath
One Breath
organization.
organization.
One breath organization.
This name comes from the
College of Chest Physicians from America. What it is for asthma patients, for COPD patients, patients with lung disorder, even one breath is difficult. One inhalation, one expiration is very difficult. So the message is coming from one breath. We make the breathing easy for you. So when even one breath is difficult, we make it easy for you. So the name of the organization is One Breath Organization, and this is one branch of the American College of Chest Physicians, the philanthropic arm, the Chest Foundation of ACCP, and this is helping us to serve the rural poor, so that patients with asthma, patients with lung problems, patients with COPD, including adults, males, females, children, old people, young people, irrespective of the age, race, and sex, they are helped to breathe and give all the education material and support them and demonstrate the peak flow meter now. It's our asthma patients who is showing to demonstrate the peak flow. చూడు నోట్లో పెట్టుకో గట్టిగా ఎంత explain to you. This is our health inspector who is going to educate the patient how much he has to blow and how he has to control his breath, and this measure of every day can help to assess the severity of the degree of the illness so that he can titrate the medication. Okay? Thank you for coming. Okay? The clinic is free.
Life's not the breath you take, the breathing in and out that gets you through the day. Ain't what it's all about. You just might miss the point, trying to win the race. Life's not the breath you take, but the moments that take your breath away.
We teach them about the value of deep breathing exercises, control their breathing so that it will not be wasted breath, and we use different audio visual material like this, and also educate about breathing. This is me talking about the college girls. As you can see, it's a poor country, they have to sit on the floor, but they are all college students, and this girl is asking me about the lung cancer, and I'm explaining to her and about the various issues related to lung cancer, how to prevent it, and explaining about different lung disorders, asthma, COPD, allergies, how allergies and asthma and rhinitis are interrelated, and explaining to them to take proper precautions to develop healthy lungs, good nutrition, and avoid smoking. And this is a one-to-one interaction which I am dealing with college students. He is asking questions about vitamin deficiencies, headaches, and how the sinus problems can give headaches. So this is one-to-one interaction which they like.
ఇవన్నీ ఎప్పుడు ఎంటీగా ఉండాలి ఓకే బట్ ఐ ఫిల్ అప్ విత్ హెడేక్ వస్తుంది డిటెక్ట్ ఆన్లీ దే కెన్ ట్రై టు హెల్ప్ ఈవెన్ రెటీనా ట్రాన్స్ప్లాంట్ అని
and here it is our free clinic where we are distributing the medicines which we give free, different asthma medicines, inhalers, peak flow meters, and educate them about proper use of the medications with the help of these workers whom I have introduced earlier, who educate the patients about proper use of the medications, when to use them properly, coordinate with the breathing so that the medicine gets deposited in their lungs. And this is our rehab facility also, which we use to help with the patients with lung problems to cope up with the activities, to develop and cope up with the activities of daily living. We are go to the churches also. I mingle with them so that they feel I'm one with them. I pray with them, and still carry the message about smoking, emphysema, COPD, asthma, and also extensively cover the problems with secondhand smoking, which apparently with prenatal exposure can cause and poor development, poor performance, and poor reading skills in school going kids. And as you can see, there are a lot of accidents due to several issues like alcohol, lack of sleep, education, and the resultant lack of regulatory laws, so that we see more and more accidents like these and the human tragedy related to the lack of sleep, lack of education, and lack of governmental regulations to control all these disasters that is happening. It has become a major public health issue, and everybody thanks One Breath organization and SCP Chest Foundation for all the help they receive, education they receive. This is their way of thanking, and they really appreciate me coming from Breath organization and Chest Foundation of America and helping them to teach all the good things in life so they get smoke free, besides maintain their cardiopulmonary health throughout their livelihood and be a good citizens.